Right. In the last session, we have discussed about the healthcare basics we have covered.
Yes.
So followed by this, we have discussed even about the responsibilities, roles and responsibilities of a BA even. Followed by how this US healthcare system works, all that.
Yes.
And majorly in reference to the insurance plans are concerned, this will be of two different insurance plans are available in US. So one is Medicare and second is Medicaid. So Medicare
Yes.
is a kind of plan which is powered by the federal government because it's a program which will be organized and managed by the federal government because federal government will have the control over this. At the same time, whatever the changes or the amendments they do may vary from time to time, right? So because this may be varying from time to time, depends on the kind of requirement it has and all everything. This may be varying from time to time, this may vary. At the same time, the second is called Medicaid program, which is majorly an state assistance program, but it's been sponsored by the federal government even because investment in terms of the reimbursements and all everything will also be participated by the federal government, but administrative access and administrative guidances followed by the kind of is there any kind of rules or the policies and procedures varying from state to state. Across 50 states it may vary because in some states you may have the similarity, of course, but I don't say that there will be a major differences, but generally there will be a similarity you can see across all the states of US. But end of the day, Medicaid is a state government program. This is not completely a federal government authority. State government program is this. And next thing is that Medicare is a program which is paid by a trust funded by with the payroll taxes, like people who are employed in the organization. For that, normally they'll pay every month, they'll pay some amount of money for the insurances, right? So for contribution, for insurance contribution and all that, they pay. So on that context, generally this Medicare is being used. And this is a program which is something same and common for all the what we call for all the people across the country, right? So because this is not something separate from one country to one country, so it is common for all the country people and all that. So for everybody who are in the country, especially on the grounds of that, whoever is an employer working for an organization, from that context, there's generally this program is being used for. At the same time, this is a program majorly invested as well as majorly depends on the people who are having more than 5 years of age. Means this program is majorly beneficial to the person once they cross the age of 65. Whatever the regular medical related reimbursements and all, everything will be taken care of under this fund. And this will be sent to the contribution tax because there is a tax fund which is as separate in the federal government, where this fund, the amount of fund, what is that we collect from the employees and all everything will go to the fund. From there, generally this reimbursements and all everything will be taken place. At the same time, whoever are the participants, means the people whoever has this Medicare can pay deductibles, and at the same time part of coverages and all everything can also be done by these people also. But here is a difference where it is being what happened? Are you not there? Okay. Okay. I'll wait. No problem. Please comment. Okay, okay, right. So,
Yeah. Okay.
okay,
So I
let-
joined from the phone.
yeah, you can be there here. I'll start. I'll continue. Anyway, no problem.
Okay. Okay.
Okay,
Okay.
so this is what generally the Medicare plan was, which is a federal government plan, which is an insurance one.
Right.
Majorly, this is being divided into 4 different parts. One is Part A, Part B, Part C, and Part D. Normally, among these 4, Part C is a kind of plan which will be given to the private insurance companies. It is not being handled by the Medicare team, because Part C is a kind of plan. I'll discuss about the details about ABCD later. But C is a kind of plan which will be used, which will be managed by the private insurance companies, because insurance companies, this will be provided for the private insurance companies to manage this. So Part C plan will be taken care of by the private insurance companies. This is point number 1. At the same time, remaining A, B, C followed by A, B and followed by D and all everything will be managed by the Medicare itself. This is the first thing. Second, when we talk about Medicaid, Medicaid is a federal government as well as state assistance program, wherein whatever the taxes and all everything are applicable for the both ends. Even federal government tax is different. At the same time, state government taxes will also be as separate. Followed by this, if there is any kind of local taxes which is being which are applicable, especially depends on the kind of city it belongs to, right? So because even in that state, because different cities will be there, depends on that, maybe this taxing structure and all everything will be applicable under this Medicaid. This is the first point. At the same time, the second the difference is in Medicaid is that this program differs from state by state. Means whatever the offers as well as the coverages I am talking about, major coverages and offers remain standstill. That won't be any having any changes in it. But there will be some special coverages, means may have a difference from state to state, because this program is being sponsored by the state government based on the kind of rules and regulations as well as the kind of decisions what is that they have taken to govern the administrative activities and all. This will vary. This is one more point. And this is the kind of plan which is majorly used and beneficial to the people who are low income group people. This is not majorly meant for not meant for the regular people and all. So this is majorly targeted for the people who are in low income group and disabled children, all that. At the same time, the participants will not require to pay any kind of amount as separate, and if there is any kind of amount to be paid, and that amount will be very nominal in percentage, right? So that is one thing which you need to understand. At the same time, of course, there will be different exams and all, everything will be conducted. That is so this is how generally one should differentiate between Medicare to Medicaid. So Medicaid is a plan which is completely over the control over the federal government, whereas Medicaid is a plan which is controlled over by the federal followed by the state government. These are the differences. Now, when we talk about the common coverages you can see in the middle circle. Common coverages are those. Common coverages which are applicable for Medicare and Medicaid, as the first point, benefits people with disabilities. This is one thing, because whoever is having a disability, those people will get benefit out of this. Either it could be Medicare or Medicaid. Next. Second thing is that prescription of the drug coverage. Whatever the drugs they use, means medicines and all everything, that prescribed drugs, right? I'm talking about this, right? So underline this point. Prescribed medicines, whichever was prescribed by the medical practitioner, that coverage cost is being included in it. Next, outpatient hospital care, right? Outpatient care will also be, because it's not only inpatient, because normally inpatient care comes under insurances and all that. Even outpatient hospital care can also be added into this existing ones. So these are the major differences. What is that you see between Medicare to Medicaid plan? Now, being a business analyst, one should able in a position to understand about the Medicare and as well as Medicaid. Followed by this, how this Medicare and Medicaid process works, that understanding is required for you being a BA. Along with that, you must be knowing about any recent amendments and changes happens or not. Because normally these recent amendments and changes are nothing but the business rules. Right? For example, if you take any organization will have a business rule, right? Organization will have a business rule. So that business rule is to function that particular organization on a particular functionality, right? Particular business or a particular process. But this business rule may change sometimes. These business rules may change sometimes. Depends on the business strategy, what organizations follow. These business rules may also changes. In the same manner, when we are talking about these plans like Medicare and Medicaid, depends on the kind of decisions what is that government has taken. Usually there will be some based on the rules I'm talking about. I don't say business rules, but based on the rules, what is that regulations and all everything were changed, automatically those will be impacted in the Medicare and Medicaid. If it is something comes under this territory, this will be changed for us, right? Changed with it. So being a business analyst, this observation is required. Why? Because there could be some necessary changes to be made in the existing applications, right? In the existing application, we have to make some necessary changes. To address those necessary changes and all everything, being a business analyst, one should have a clear and as well as close eye over the Medicare, followed by Medicaid plans. Clear, Jason, right?
Yes.
Right, so this is what. Now, this is what generally an overview of Medicaid, where in reference to the different columns I was mentioned here. When we see about the Medicare and all, this is will be for 65 and older people, as I told you. At the same time, when it comes to the funding sources and all, this is from the payroll taxes and all, everything this will get deducted. And source of control is federal government. At the same time, when you're talking about the changes in reference to the ACS and all everything, higher deductions will be happens for the people whoever is having higher income. This is anyway common because anywhere, even in India also you can see higher brackets of salaries, higher taxing structure, right? Everywhere it is. The same thing applicable even in Medicare also. Higher deductions from the people who are having higher income, automatically that higher amount of percentage deductions will be applicable because this is based on the percentage, not the fixed amount. Please do remember. Right? This is not based on the fixed amount, percentage. Percentage depends on the income, what is that person will be, you will be getting, right? So that is where it was. Now, when we are talking about the long-term custodial case for the pays and all everything, Medicare doesn't allow all that, right? Medicare doesn't allow this custodial care in reference to the long-term plan, all that itself. But whereas when it comes to Medicaid, yes, Medicaid has the feasibility and possibility, point number one. Second, Medicaid has a specific this thing like category of eligibility based upon the income, at the same time children, this pregnant women and so on and so and so, right? So the remaining people will comes under this territory called population stuff. At the same time, funding sources and all everything will be from FMAP because this is a federal match of state funds, as I told you earlier some time back. This is being all governed by the state governments, but funding and all everything will be taken care of by the federal governments. Usually, federal government will have some what we call federal government will have some fund percentage they will maintain to manage all the states and all everything. Some amount, I don't say that 100% coverages, but some amount of coverages will be done by them accordingly. Next, source of control is state government with federal guidelines. That's what I said, because everybody has to honor the federal government guidelines itself. Even though it is states, everybody has to come under that category. So everybody has to follow the federal guidelines. This is one more thing. At the same time, states are participating in Medicaid expansions and all everything, where eligibility coverages and all everything will be something applicable to that.
Then what is 133% applicable?
Percentage of fixed amount of fixed percentage liability. This is.
Oh,
That is 133%. Up to, I am saying, that is, which is maximum I am talking about. That is up to, not the minimum, right? Up to 133% FPL, fixed percentage of liability will be eligible for a coverage. Up to 133% for state participants and all that. At the same time, long-term custodial cares and all everything are applicable under the Medicaid. So these are the two major differences. Being a business analyst, one should understand. Now, this is about the claims. Whatever the third slide I have explained, I have sent you. This is the slide which was prepared by me, where you can see, for example, if there is any kind of claims to be made and all, this is how generally claims will be taken care of. For example, in any biller, because medical coding will be written by the biller, right? Medical coding they write. So whenever they write the medical code, usually to create claims, means once the treatment is done for a patient, whenever they wants to create claims and all everything, they have to add all the additional information of the patients, followed by the patient visits, followed by the cost of procedure, has to be mentioned by the medical coding person in the claims. Whenever they are creating claims and all, they are taking two kind of codes. One is procedure code, second is diagnosis codes. What is the procedure code? Procedure code means whatever the procedure in healthcare people have performed to do some treatment and all, everything comes under procedure. So for different procedures, there are different code numbers are available.
okay.
And second, when we talk about diagnosis codes and all everything, for different diagnosis and all, there will be different ICD codes are available. So those codes are applicable here. So if anybody wants to create a claim form and all everything, if a biller wants to prepare, they have to consider the procedure codes. They have to consider the diagnosis code. That's the reason why in the beginning, as I have told you, whatever the codes we maintain, whatever the processes we follow, everything is based on the code numbers. Everything is based on the code numbers. That is not something something to do with what we call something to do with the direct details of those procedures on that, right? So because every procedure will be having a code number, encrypted code number. That code number, based on that code number, claim form will be prepared. And whatever the claim form we prepare based on the code number, that will be received by the insurance organizations. And whatever the procedure of claim adjudication, claim processing and all, everything will be taken care of by them accordingly. Understood, Jayashree, right?
Yes.
Right. So when you talk about in a high level note, when you're talking about creating of claims and all everything, this is how and what it works. Clear? Right.
Okay.
Right. So this is what generally the overall about Medicare, Medicaid, and as less, of course, I have not explained the detailed part of the create claims because there are different codes like 835, 832, all that I'll be explaining slowly. Slowly I'll get into it. Okay. Tomorrow.
One little question, Raj. So this, you explained Medicare and Medicaid. So in Medicare, you are saying about benefits.
Your voice is breaking. Yeah, can you come again?
Yeah. So you are saying Medicare is for benefits over age 65. So people like us who are not 65, what is that we are having in US now? What kind of a,
means
like
100% benefit will be provided after 65. Below than that, usually what happen, there are coverages will be applicable as people are paying regular tax, they are regularly paying the tax percentage contribution amount they are paying anyway. That is applicable to them. But the major benefits will be applicable after the year of 65. That is the point. And second,
but do we also come under Medicare or like
you are all comes under Medicare? Yeah, you are all come under Medicare only.
Okay.
They
Got
all
it.
come under Medicare plan only, and whatever the amount you are paying, you will be paying from the salary itself. You pay contribution
Oh,
tax.
yeah.
That's what we call it
Yes.
as contribution tax is there. For the federal government
Yes.
contribution tax is there. So for the federal government contribution tax, this amount will be deposited. That amount will be
Okay,
deposited. From there, usually, because if there is any kind of treatment and all everything, for anyone for related medical related things and all everything can be, but 100% coverages, the complete responsibility over their medical requirements, needs and all everything will be honored after 65 years of age. That's what it
Oh,
is.
okay.
And
Got it.
apart from
Got
this,
it.
normally
Got it.
what people do, people will manage private insurance also, because normally depends on their financial position. What some people do is that anyway they get insurance from the employer, because that is where this is comes under that. At the same time, what some people do is some people pay private insurances also. They pay private insurance premium, right? Because if they are eligible and if they are capable enough financially, they take. Like that means dual policy, because they have Medicare policy, at the same time they have a private insurance policy also. Sometimes it will be like that also. Do you
Okay.
understand, right?
Got it.
Because some people, what they do, as a part of their job, anyway some amount will be contributed to the Medicare, right? Anyway, that will be there. There are provisions, they have that facility to utilize it when and wherever it is needed. But apart from that, some people, what they do, they hire private insurance plans also. That is also there.
Oh, yeah.
Understood?
Yes.
This is what it is.
Yes.
Okay, right.
Yes, Raj. Thank you.
Right. We'll meet tomorrow. Bye.
Thank you. Tomorrow. Yes. Thank you.